Right now, here at 10:02, again, want to switch gears here and talk about South Carolina. Serious matter at that, because they're now dealing with its fourth confirmed case of measles this year. The latest case reported in the Upstate. It's a highly contagious virus, so it does have health officials concerned. Dr. Linda Bell, state epidemiologist and health programs branch director at South Carolina Department of Public Health, joining us here live this morning. Good morning, doctor. Thanks for joining us this morning.
Good morning. Thank you for having me.
So, doctor, like I said, fourth confirmed case in South Carolina since July. What concerns you most about this case now in the Upstate?
Well, several things concern me. The fact that we've had 4 cases in the last few months, and that is more cases than we've had in the last 7 years. The concern is that we're seeing a resurgence of measles in this country, and the risk of imported cases into South Carolina is increasing because there are more cases. There are outbreaks, over 1,500 cases in the United States now. And anyone who travels out of state, out of the country, is now at increased risk of being exposed to measles. And the second concern is that this is occurring while our measles vaccination coverage in the state is declining.
And then this person, we do know that the patient has no known exposure to someone with measles. So how does someone contract measles without a known source? What can you tell us about that?
Well, the measles virus is actually spread by spread by respiratory droplets, from an infected person. And so anyone who can breathe in these respiratory droplets, and they're not immune by having been previously vaccinated or having the disease naturally, are at increased risk of becoming ill. Now, the measles virus is so infectious that you don't even have to be in the room with the person at the same time, because the virus can remain active in a confined airspace for up to 2 hours after the person has left that area. So there are several ways that you can be exposed without knowing it. The other way is that people may be shedding the virus before they're actually showing symptoms of the rash. So you may be coming in contact with someone who doesn't appear to be ill. So you can come in contact with their airspace or the person while they're ill or after they've left the room. And this makes it one of the reasons why it's so highly contagious, and emphasizes the importance of people getting vaccinated because of these unrecognized exposures, with the increased number of cases occurring in the United States. And then our 4 cases here recently in the last few months is of great concern.
All right, let's talk about the vaccine. How effective is the measles vaccine? And then what's driving this vaccine hesitancy, doctor?
Well, let me say a few words about the effectiveness of the vaccine first. We actually achieved eradication of measles in this country 20 years ago, and that is exclusively due to the effectiveness of the vaccine. Prior to about 1957, which is the date that we consider most people born prior to 57 being immune, is because prior to that time, prior to the availability of the vaccine, almost everyone contracted measles. So with the availability of the measles vaccine, we brought the ongoing transmission of measles in this country to 0. And now we are seeing this resurgence, whereas 20 years ago we had eradicated it because of the effectiveness of the vaccine. This is the concern. And just a few more words about the effectiveness of the vaccine. A single dose offers lifelong protection for about 95% of the people who get the vaccine. We recommend a second dose for young children. First dose is due at 12 months of age, and then the second dose at 4 to 6 years of age, to get that additional 5% unprotected after the first dose to up to about 97%. And so that's how it is. And I can't answer easily the concerns about the vaccine. We know that all vaccines may have some adverse effects, but they are very, very, very rare as compared to the complications from the disease itself.
Who should be getting the vaccine, and are there certain groups that should not be receiving the vaccine then?
Well, all children 12 months of age and above should get the vaccine. Adults who have not previously been vaccinated should get the vaccine. The only people who should not get the vaccine is pregnant women should not be vaccinated while they're pregnant. And there are people with some immunocompromising conditions, people with a weakened immune system. Certain people may not be able to receive the vaccine, and they should consult with a healthcare provider. Just one more point about getting our vaccination coverage up is that it also protects those people who cannot be vaccinated because they're too young or because they have underlying medical conditions that don't allow them to be vaccinated. If we maintain high population coverage, then we're also protecting anyone who can't be vaccinated, as well as protecting yourself against the potential complications from the measles that can be quite serious.
Yeah, I was going to ask you, what are these complications involved? How dangerous is this virus?
Well, the complications of the infection can lead to pneumonia. Actually, secondary pneumonia is the leading cause of death from measles, particularly in young children. And the measles virus can cause inflammation of the brain. It can lead to long-term neurologic effects, either from the acute infection or actually some people years after the infection can develop neurologic complications. So there are many cases of people, especially young children, again, can be hospitalized. And we've already seen deaths in this country from measles, so it can be very serious.
All right. So, what should parents be looking for when it comes to symptoms, and when should they start seeking medical attention?
Well, the initial infection with measles virus causes sort of an upper respiratory symptoms with a runny nose, a cough, very red eyes are characteristic. Sometimes you will see these dark spots on the inside of the lining of the mouth. And after those early symptoms, a rash develops about 3 to 4 days later. And the rash starts on the face and then can spread to the rest of the body. We see a fever, especially a high fever. And so those are the symptoms to look for. If those symptoms develop, we caution people to let their healthcare provider know of those symptoms before they just show up in an emergency room or a clinic where they might spread the virus to others. As I've said, that's very high risk, and especially if they're unvaccinated. So if you're not vaccinated and you develop those symptoms, and if you've traveled anywhere or you've been in contact with someone who has those symptoms, let your healthcare provider know so they can properly evaluate you with the laboratory test to rule in or rule out measles.
Do you know if these 4 cases in South Carolina are connected in any way?
So the 2 of the cases were household contacts. The other 2 cases were unrelated to each other. So only that household transmission with 2 cases occurred, and the other cases are unrelated to one another.
Okay. And as we head into the fall and winter season, we hear about respiratory illnesses more often. Your message to South Carolinians this morning?
Well, we have the opportunity with vaccines to protect against a number of vaccine preventable diseases. So we're very concerned about measles. We encourage people to check with their healthcare providers and make sure they're up to date. But as we move into the flu season, we strongly encourage an annual flu vaccination because the virus changes itself frequently. And so to be up to date, to get the best protection against the currently circulating strains, you should get a flu vaccine every year. Same thing with the COVID vaccine, because that, as we know, the virus that causes COVID infections changes frequently with new variants. And so the vaccines that are available now against COVID are the ones that are well matched against the most predominant circulating variant now. Offers the best protection. The vaccines are very safe. People ask more questions about potential complications from vaccines in general that are quite rare, but they forget to ask about the complications from the diseases themselves that these vaccines prevent. Hospitalizations, complications, deaths, or even mild things like getting the flu and having to miss work or school for a week or so. All these things can be avoided, as well as spreading the virus to others in your home or your community who may have more severe complications.
All right, Dr. Linda Bell from the State Health Department there in South Carolina. Thank you very much for the information on measles
Thank you
and
so
the
much.
latest there. Appreciate you.